Hello everybody, we are going to talk about the DMS FMGE hack series, and today we are going to talk about the ENT. So speaking about the ENT, we are having the very high yield area is your ear, followed by the nose, followed by the throat and the miscellaneous conditions. So speaking of that ear, in the ENT, the 60% of the questions are occupied by your ear, and remaining 30%, 25 to 30% are occupied by your nose, and remaining 10 to 12% are occupied by your throat, and remaining 4 to 5% are occupied by the miscellaneous conditions in relation to your ENT. So we divide the ENT same like ophthalmology, like we divide anatomy and physiology, followed by pathology, followed by medical and surgical, diagnosis or investigation, and followed by medical and surgical management. So same like we did in the ophthalmology, we are going to do it here as anatomy and physiology first, followed by pathology, followed by diagnosis and investigation, followed by medical and surgical management. So as per the FMGE point of view, the high yield areas that you have to remember is your anatomy of ENT, and in the ear you have to remember four important disease. One is your otosclerosis, Meniere's disease, and otitis media, which is acute, and media, which is your acute and chronic. These are the four diseases that you should keep in mind in ear, where you should master every single aspect. And then in the case of a nose, rhinoplasty, surgical intervention, rhinoplasty, and then cleft lip, cleft palate, cleft palate and cleft lip, and lip injury and allergic rhinitis are the areas you should remember. Allergic rhinitis are the areas you should remember. And in the case of your throat, anatomy of throat is very, very important. Anatomy of throat and laryngomalacia are very, very important. Okay, these are the areas that you should read in the ENT, where for the FMGE perspective you have to master. But how we divide the ENT was we divide it into four sections. One is your anatomy and physiology of ENT, where you will read the development of ear, nose and throat, external, middle and internal ear anatomy, paranasal sinuses, oral cavity, and pharynx, larynx, and anatomy of your pharynx and larynx are pretty much covered in this area. And then you have the physiology of hearing and balance, where you see the hearing, vestibular system, semicircular canals, and a static equilibrium. So how does the auditory pathway and vestibular pathway is working, and how does the anatomy of your ear, like external ear, middle ear, and inner ear, and what are the origin of these structures are pretty high yield people that you should not miss it out. And apart from that, you have the like nose anatomy, like all the meatus and the turbinates, and what are the sinuses that flows into this area, little area of your nose, and what are the blood supply to that dangerous area or little area of your nose. And then you have this conditions like allergic rhinitis and those things you have to remember as pathology. Okay, so and then you have the oral cavity anatomy along with the larynx and pharynx anatomy that you should remember. And apart from that, physiology of your auditory and vestibular pathways you have to remember. Okay, then you have this pathology. Speaking about the pathology, so you have to remember that otitis media, otitis externa, Meniere's disease, acoustic neuroma, cholesteatoma, tinnitus, and hearing loss. Among that, the whatever the I mentioned you in the previous slides, which was pretty important, those four diseases you should not miss. And in the case of nose, rhinitis, sinusitis, nasal polyps, epistaxis, allergic rhinitis are the things you should remember. And in the case of your throat pathology, pharyngitis, tonsillitis, peritonsillar abscess, laryngitis, and vocal cord nodules and polyps you have to remember. that you should not miss a single area in this, people. So pathology, whatever the diseases I told you, whatever the anatomy and physiology we told you have to remember. Apart from that, you need to remember a few things like so called as the examination and investigations. So the test for ENT they may give you, the test for ENT are pretty important. For example, like a tuning fork test, BERA, are the like a named test which is very important in this case of your diagnosis and investigation. So audiometry, tympanometry, otoscopy, ENT examination, and for ear test for hearing loss test for hearing loss are pretty important. Hearing loss are pretty important, which is kind of like a 5-star rated topic. And apart from that, you may have this radiological investigations like CT scan, MRI scan, X-ray, PNS, and ultrasonography are the areas that you should not miss. Okay, so CT scan, MRI scan, and X-ray, PNS, and ultrasonography, and especially the Waters view are pretty important. What type of sinuses can be viewed from Waters view is really important. That I leave it to you for the homework. And then you have this medical and surgical management. Speaking about the medical management, antibiotics, decongestant, antihistamines, analgesics, mucolytics, and steroids contributes. And surgical management, myringotomy, tympanoplasty, mastoidectomy, stapedectomy, septoplasty, FES, tonsillectomy, adenoidectomy, and laryngectomy. All the surgical procedures are pretty important, especially the FES. We are doing it for the mucor and aspergillosis sometimes. But what is a FES? Functional endoscopic sinus surgery. You need to know about the importance of the FES, because FES is nowadays a choice of question. As we deal with the current trend, as we deal with the post-COVID mucormycosis, the FES is always a choice of question, people. You should not forget it, okay, in terms of your ENT. So this is all about the ENT. So you have to remember whatever I told you in the previous slides, and you have to cover those basic areas. So thank you for watching. We meet you with another new subject.